स्टार्ट చేసి डोर बंद कर देना। हो गया चल। Good afternoon, students. Yesterday we have discussed regarding the clinical presentation, the examination, signs, symptoms, and few investigations, and in general management of a ulcer. Everything is same. The patient's presentation will be changing today. Today we will discuss regarding the clinical examination of a swelling. Simple. We will be bothering only about the clinical examination. And what do you mean by swelling? How you are supposed to approach to a patient of swelling. For all practical purposes, swelling, lump or mass are usually for a short question. That means short question in practical examination. Long question is usually lump in abdomen, some pathology or TAO varicose. So here your proper examination skill, your presentation skill, and the idea or understanding why do you doing that test and what you are going to expect out of that. So there are different types of tests. We go for the clinical swelling. First thing first, what do you mean by a swelling? First, swelling refers to enlargement or protuberance of an organ or tissue, wherever it is occurring from. Whichever organ it is or tissue, it is an enlargement. Swelling is an enlargement of a tissue for all practical purposes. What type of tissue? Anything. Thyroid swelling enlargement, we mean thyroid, nodular thyroid or thyroid goiter. Parotid swelling enlargement, we mean parotid gland, whether this is a different type of parotid swelling, commonest is a Warthin's tumor or a adrenolymphoma, or you can call it a different tumors. And the lump. Lump refers to a vague mass of body and small irregular palpable mass. Lump refers to a mass of body. Also it means palpable mass. In fact, there is no clear-cut differentiation. But for a convenience, the name is given to different organs. We don't call a mass in neck. We call it as a swelling in neck. If it is abdomen, we call it mass. Same thing, same pathology presenting in a breast, we call it lump in breast. That means for all practical purposes, a swelling or a mass or lumps means same thing in different organs. And the name depends on the organ which is involved. So, what is swelling? Swelling is an obvious enlargement of a part of body which can be of a different causes. Now we know it is a swelling. So what is our job? Is to find out why this swelling has occurred. And practically there are three categories: congenital, inflammatory and neoplastic. In fact, all these can be clubbed together and form to different type of reasons. Traumatic also can be added. So what is mass? Mass denotes a lesion which has difficulty to define the extent. Now you are getting a technical difference. In a mass, it is a vague thing and extend this area to this area. It is difficult because in abdominal mass, you cannot directly identify the edges. So mass in abdomen, we call it mass, where definition of a border is difficult. You can give an idea, but not clear cut. Whereas what? A lump. When you say a lump, it is a defined lesion in an organ or which causes gross shape disturbances. Size can be specifically denoted or measured. So lump in breast, we call it lump where the measurements are acute, to the point. Mass, they are a vague measurement. This is a general difference. It is only English language difference and convenience. Broadly, we always classify swelling as solid, cystic and pulsatile. And above we have seen, we are calling it as a different types of pathology. That is congenital, inflammatory, neoplastic. Then solid, cystic, pulsatile. So you have to define a swelling in two ways. whether this is congenital, whether it is cystic, whether inflammatory, whether this is solid. If it is neoplastic, it has to be solid. Congenital swelling can be pulsatile. That means swelling can be either congenital. In addition to that, the classification of cystic, solid and pulsatile. So you have to say two things. The swelling is inflammatory and it is solid in consistency. Okay. So you are getting nearer to the what is the swelling means to you. Common swellings. Common swellings are fat tumors, nerve tumors, sebaceous cyst and malignancy. Don't have to think too much. Think common things. In examination, what you should do? First of all, make a habit of asking questions to yourself. Whether I am saying is right or wrong. If you ask yourself, you will get more answers. First question you ask yourself, oh, what is the cause of swelling? Then your mind starts working. Is it congenital? Yes. Then what it is? Hemangioma, dermoid, branchial, lymphangioma. Because congenital swellings are limited. It is traumatic. Traumatic. Then what? Most likely hematoma, organized hematoma or fresh hematoma, bone trauma. Traumatic can be AV fistula. Chronic consistent trauma can cause arteriovenous malformation and fistula. The patient is giving history of parasitic. That means he is a shepherd. And lump in abdomen. What do you think of? Hydatid cyst. Okay, asking question yourself, you are coming nearer to the answer. Oh, it is inflammatory. That patient has a high grade fever and swelling. Then what is it? It is either boil, either carbuncle, or if a low grade fever, it is a chronic abscess. See, asking yourself is you are getting answer. Ask yourself, whether it is neoplastic. You examine and you come to know that it is neoplastic. Your diagnosis is more easy. Commonest is SSS, that is soft tissue sarcoma. Neurofibromas and metastasis in lymph node. Most common swelling in the neck is metastasis of the lymph node. So the answer is there. Is it tuberculosis? Now you will ask a related question to the patient and patient say, yes, I was suffering from tuberculosis. Diagnosis is made. It is a cold abscess. Okay. So asking question yourself, you are getting diagnosis. This is simplest way of coming to a conclusion. And parasitic, hydatid or a cysticercoid. Cysticercoid is known in Western countries. In our country, in some region, hydatid is common. You also have to think which is a common pathology in the region where the patient is coming from. Always keep that in mind. Don't give any fancy diagnosis. Simple diagnosis, simple treatment, symptom analysis, simple investigation and simply passing. Okay. So what are the swellings? All the cystic swellings. What they are? They are either congenital or acquired. If you just go through this graph, your diagnosis is certain. Congenital swelling, commonest on face, sequestration dermoid cyst. In front of neck, branchial cyst or thyroglossal cyst. It can be lymphangioma just below the chin of the mandible. And in abdominal wall, a remnant of a urachal cyst, you get a urachal cyst near the umbilicus. And there can be vitalointestinal duct. These are the commonest congenital cysts. But practical purposes in examination, you will always get a dermoid or lymphangioma. Sometimes thyroglossal cyst, because they are not very common. Commonest dermoid and lymphangioma. Lymphangioma occurs in very young people. Branchial cyst very rare. So common diagnosis. If it is a congenital swelling, your diagnosis practically is a dermoid. Acquired. Practical diagnosis. A retention cyst. What is your diagnosis? Sebaceous cyst. And another in female lactating galactose. Okay. For all practical purposes, acquired cyst, your diagnosis is sebaceous cyst whenever occurring on the extremities, abdominal wall, sometimes on the back. In male with some history of trauma, it is a spermatocyst. If the swelling is distension, slowly growing in size, then in neck, thyroid cyst. In abdomen, usually in young female, ovarian cyst. Exudation, that means excess of the fluid secretion. What it is? In males, hydrocele. Degeneration cyst, the necrosis of tumor. Traumatic, hematoma and Most common diagnosis in agriculture worker, it is implantation dermate. Any person with a worker coming at a painful swelling in a finger or toes or in the sole, you always think of implantation dermate. Very, very common diagnosis. And intraabdominal cystic tumors in female, commonest is cystoadenoma of ovary, and in adult alcoholic pancreatic cyst. So for practical purposes, you have got only two diagnoses: dermate cyst or sebaceous cyst. Congenital dermate, acquired sebaceous cyst. Rest depends on the pathology, but this you must keep in mind. So you have come to a diagnosis. Okay. Then what are the different tumors? This chart shows all types of tumors which are commonly occurring in or we can get in examination. Commonest of all is lipoma. What it is? It is a universal tumor. Okay. Next is any cystic swelling. Cyst is accumulation of fluid. Nothing any extraordinary. Cyst is accumulation of fluid, which is balloon. It is a bladder-like swelling. Dermoid, sebaceous cyst and neuroma. This is what you usually get. Sometimes fibroma, neurofibroma, and very common in young age is ganglion. Ganglion is the only one of the best pathology which can be diagnosed only by looking at the swelling, because it occurs over the unit joint. She looks to try to catch her. This is just in the dorsum of the hand. Dorsum of the hand in the carpal unit joint. Any swelling fluctuation occurring, it is ganglion. No other diagnosis. Papilloma can be there. Warts, glomus tumors just below the nail. There can be bursa, usually in the joint. Semimembranous bursa. Moret-Baker cyst, which occurs also again in the knee joint. Lymphangioma, but lymphangioma is congenital. Lymphatic cyst, chondroma epignathus. They are difficult names. Forget about them. Remember lipoma, cyst, dermate, sebaceous, and fibroma, and ganglion. This is all you are going to examination. Orthopedicians can get a Moret-Baker cyst or semimembranous cyst. But for you, practically 5 diagnoses for any swelling: lipoma, cystic swelling, dermate, sebaceous, fibroma, and ganglion. Okay, so you have cut down the list. Now, how are you going to proceed? Same thing what we have discussed last time. Same pattern as we did in ulcer. Pattern is now you must get the pattern by heart, because it is you who have to do it. I am going to tell you do it like that, but it is you. So you understand how are you going to proceed. Always name, age, sex, occupation, place, and presenting complaints. This is how you have to take from patient or a relative. Now comes your specific job. Remember, inspection solves many problems. Very good inspection, very good doctor. Understand? If you know how to look at the patient as an angle of doctor, you are solving the problem. So what comes first? Sight. Because the diagnosis of a swelling depends on the site. Same like ulcer. Because whatever organ is there, that will swell. If I talk of something funny in right iliac fossa and I say that right iliac fossa, this is a splenic injury or splenic, that is no value, because the spleen is in the upper outer quadrant, left side, left upper quadrant is spleen. And how can I diagnose a spleen in a right iliac fossa? There is no point. So you must know what are the organs in that region. Okay, as a dorsum of hand, ganglia. Outer canthus of eye, external angular dermite. Okay, and flanks, side of the body, it is a lipoma. That means you are coming to conclusion depending on the site. Duration. How do you come out to duration? We have to ask the patient what is the duration. When did he notice the swelling? Notice may be long. Somebody will give you, smart person will give answer, oh, I have got since birth. Diagnosis is meningocellular lymphangioma. Oh no, sir, this is last few years, but I don't remember. It is a long duration. If congenital, branchial. Long duration benign tumors, lipoma, sebaceous, dermate. Common answer. Oh no, it's usually for few months. Then you have to think of a inflammatory swelling and very short duration, but there is no pain. See, malignancy is just walking in our home without giving a knock. That means pain is not there. Then you think of malignancy. Anything odd occurring in the body without any symptom. This is the beauty of malignancy. So it is called as cancer. Cancer means which gives purgation in all directions. It will come from the window, it will come from the back door, it will come from the front door. You don't know from where it has come. So this is malignancy. It is called as cancer. Okay? Cancer means different legs. Now comes to how the mode of onset, how the swelling occurred. If the patient knows about it. Commonest answer for a benign swelling is we call it as a insidious in onset. And what do you mean by insidious? Patient does not remember any specific time or period or occasion when the swelling started. That is your answer. It is insidious in onset. Similarly, thyroid. Oh no, sir, it lasts 4-5 years. I don't know. It is a thyroid. Benign tumors. Oh, he doesn't know. So many years. Benign swelling. Many times accidental detection of a swelling. And relatives telling the patient, there is a lump in your body. I have seen that. What it is? Benign. See, the onset has given an idea. Sudden rise, think of malignancy. Slow rise, think of benign tumors. After trauma, he said, now this occurred trauma, always think of a hematoma. And our favorite, implantation dermatitis. So I was operated few years back. Then diagnosis is hypertrophic scar or keloid. See, diagnosis given by the patient himself. Vaccination. In our days, vaccination was very common. Now you are going to get the vaccine for COVID. But remember, vaccination is the commonest cause for a keloid. I don't know if after the COVID we are getting keloid or not. A sting at bite. Patient says, I was sting or bite by some organism. We don't know. It can be abscess. Remember, with fever, abscess, boil or carbuncle. Without pain, it is malignancy. Dull pain, stitching, it is abscess. Okay. Or tuberculosis. Here, swelling plus fever, boil. Abscess or carbuncle, cellulitis, lymphangitis. Abdominal swelling with mass together, occurring these two things. Hepatoma, renal cell carcinoma and lymphoma. So these swelling also give rise to fever. Hepatoma, renal cell carcinoma. In fact, I told you last time, renal carcinoma in 20% cases present as a PUO. That is pyrexia of unknown origin. And there in old age, you must think of a renal cell carcinoma because there will be only presentation PUO. Okay, so we are going stage by stage nearer to the diagnosis. Now the pain part. Whether direct pain or referred pain. Referred pain in parotid goes to ear. Sometimes swelling comes first, pain later. It is in infection. Whenever a benign swelling gets infected, it becomes painful. Transformation of benign to malignancy, most common, again referred pain. So this is how you have to classify the referred pain. Progress of swelling. This is very important. This question you must ask. And what you are going to ask? Whether it is rapidly growing, slow growing or stationary. And you are again getting diagnosis. See, all your questions are leading towards a diagnosis. Rapidly growing suggests malignancy. Rapidly growing but only few days. Oof. Then it is not a malignancy, it is inflammatory. There are some exceptions because phyllite tumors of the breast, it grows very rapidly within few weeks, but it is not malignant tumor. Now patients say, oh, it is there last 5 to 10 years, I didn't get time, now I come to you. Always think of a lipoma, and if it is site specific, it can be thyroid. Because for many years, females, males, they just neglect the thyroid cell because it is not causing any problem. Since it is unless get thyrotoxicosis or malignancy, it is not going to make you aware. Even parotid is there for a long time. Patient comes only if his smartness is affected or involvement of a facial nerve. These are the indication. Smartness affected means cosmetic. Okay. Slow growth for many years. Ah, suddenly, sir, this has started last 5 years. It is rapidly growing. Then your diagnosis is malignant transformation in a benign lesion. Okay, that is how you are coming to diagnosis. Well, important question must ask. Has swelling regressed in size in the recent past or since it started? Because that answer will give you the answer of inflammation. Because malignancy does not regress and inflammatory swellings do regress with rest or antibiotic. Okay, this is important, particularly what happens sometimes a deep abscess, it looks like a malignancy, but it gives history of regression with antibiotic. और डॉक्टर साहब ने दवाई दिए और थोड़ा सा कम हो गया था. If you get this in Hindi, in Hyderabad, you are happy. It is abscess. Now, other symptoms. Always ask if there are associated symptoms. Discomfort in neuroma, bleeding in hemangioma, particularly globus tumor, or what you get infected swelling over the tip of the finger, where the bleeding is very common. Okay, and smell. So very bad smell from a swelling of the chest wall or on the back. It is sebaceous cyst. The smell is very bad of the keratin. Always ask, आपको और कहीं है क्या? Do you have any other swelling? Multiple lipoma? Yes. Your diagnosis is multiple lipoma, multiple lymph node. Any change in swelling? Something went wrong shortly? Either ulceration or fungation? Again, you are going to think of malignancy. Patient says, I am operated, हो गया मेरा operation फिर हो गया साहब. That means recurrence after surgery. Remember, benign tumors will not recur after complete excision. The word is complete excision. Because if you leave something behind, it will definitely recur. And sebaceous cyst should be operated in toto, because if you leave a part of wall, it will recur after months or years. That is for certain. And who will be blamed? Surgeon. So sebaceous cyst must be completely removed. What else? The nature of the tumor. The desmoid tumor of the abdominal wall, by definition known for recurrence. Even God can't help it. Keloid, known for tendency to recur. Okay, because keloid have been so many treatment have been tried, but recurrence is its nature because it is a different type of collagen. And you have done everything very nicely. Wide excision done 2 centimeter all direction. Again it has recurred. Then you must think of malignancy. See, the history is taking us to diagnosis. Then comes the examination. In history, you have come to probable diagnosis, but you should not tell. Don't jump to it. Now our role is systematic as a doctor. What it is? First come first. It is inspection. Remember, inspection is one of the most beautiful thing. You have to inspect. Inspect means just look at it, observe it, and careful observation will help you to arrive at a diagnosis in many cases. For a short case in surgery, usually very site specific. So, diagnose by open eye and open mind. Both things should be open. Do not believe in what your SRs have told you. Oh no, this is this. No. You think yourself. Maybe he has told you the diagnosis because you are a friend of him. But you give reasons. You may find something else because he also doesn't know. The case has just come just now. So inspection is with open eye and open mind. Many of the inspection depend on the location. Midline location in front of neck, thyroid. Dermoid line of fusion or outer canthus. Ganglion, dorsum or scapholunate articulation. Oh, this is the joint. Plexiform neurofibroma, very common diagnosis, and where it occurs, distribution of ophthalmic branch of a trigeminal nerve. This is a classical distribution of a plexiform neurofibroma. Then how many of them are there? Multiple sebaceous scrotum, diagnosis is self-explanatory. Multiple swellings over the skull, benign, long-standing, again sebaceous cyst. Multiple lipomatosis and multiple abscess in diabetes. And skin deposits at different places, it is metastatic skin deposits. So the number also has given diagnosis. Then comes extent, size and shape. As you are doing inspection, you have to be approximate. You cannot give exact size, but approximation should always be in the transverse and vertical direction, not in a single direction. Both directions you must think. What you are supposed to say, sir, this is 2 centimeter by 2 centimeter swelling occurring over the dorsum of the wrist, or it is on the mid thigh. Similarly, if possible, try to describe the shape, because shape also is many times very particular, because on the chest if swelling is a butterfly shaped swelling, diagnosis is made, it is a keloid. Okay. Now sebaceous cyst hemispherical, thyroid cyst vertically placed, desmoid overspherical, squamous cell carcinoma diagnostic is cauliflower. Then on inspection you can see a smooth surface dermoid, irregular surface malignancy, nodular surface multinodular goiter, and bossylated, that means large swelling. Many times lipoma also looks bossylated like this, all different on its own. Age. In ulcer, age is between the margin and floor. Here, margin is a limit of swelling. You see the difference? In ulcer, age is between the margin and the floor. Here, it is the outer limit of swelling. And many times in a deep seated structure, you cannot clearly see the edge. You can see the region. Now comes the skin over the swelling. Red erythematous, inflammatory. Red shiny, soft tissue sarcoma. Pigmentation, molar nevus. Blackish spot. Blackish soft over a soft swelling is diagnostic of sebaceous cyst. It is a punctum. So if it is a punctum, you don't have to think, see, it is sebaceous cyst. Pulsations. Be very careful for pulsations in some regions. It is life-saving. What is pulsation? It is the expansile pulsation of aneurysm. Expansile means they are in both directions. They also move your hand by the side. It is not only like this, it is also like this. Okay, it is the anterior, posterior, and lateral direction. That is the expansile in all directions. Okay, and whenever there is a referred pulsation, it is in a vertical direction. That is why you have to differentiate between arterial swelling and the swelling which is referred. Remember, aneurysm, commonest site is popliteal fossa. Any swelling in popliteal region, think of popliteal fossa. Any swelling in the neck carotid region, think of carotid tumor. Any swelling in suprasternal space, think of innominate. And this is innominate space of birth. Remember, why you should remember? Must give 10 times thought before incising, for thinking like an abscess. Never do that. Investigate, confirm, then only go for opening. Okay. How you confirm it? By examination and by USG. Very simple now. Now movements with deglutition. Beautiful thing. If it is moving deglutition, anterior midline swelling, diagnosis is made. It is a thyroid swelling. And the patient examiner will ask you why it is moving with deglutition. Sir, this is attached trachea by Berry's ligament. That is why it is moving with deglutition. It is also with the protrusion of tongue, again thyroglossal cyst, because it is attached to the base of tongue. Now comes what are the effects? They are called as the pressure effects of swelling. You have to look for the periphery of the swelling for finding out the pressure effect. Neck lymph node, pressure over nerve. And what it is called as? Pressure over nerve. And the symptoms at eye, it is called as Horner syndrome. Soft tissue sarcoma in the arm, radial nerve paralysis. Wherever the veins are compressed, what you will get automatically? Varicosity. And large popliteal aneurysm always look at the foot. Foot drop is one of the sign of a large popliteal aneurysm. Also mentioned regarding the surrounding area periphery, whether the periphery is pigmented, whether there is associated edema. That is, you have to describe the swelling. Now it is your job as a doctor. You are first seen as an actor or by eyes only inspection. Now you are palpating, and in palpation, as usual, you will always look for tenderness and temperature first. From where you palpate? From the dorsum of the hand. Why? It is more sensitive. And why it is more sensitive? Because many cutaneous nerve endings end there. And remember, the skin of the dorsum is thinner than the palmar edge. Yourself you can see, you feel it, ha ha ha. On palm, nothing is happening. So it is a cutaneous nerve ending over the dorsum. Okay. Now inflammatory swelling will inhibit cold abscess, confirm side and shape, again confirm on inspectory findings, must be reconfirmed on palpation. Border or edge. Now you have got a hand, you can palpate the border and if possible try to make it. And what is the beautiful thing? The pathognomic sign of lipoma is a slip sign. You must be able to demonstrate this. What is it? Whenever you press over the lipoma in the periphery, it will slip, it will go away. It is going away, not indenting. If it is sebaceous, it will indent. It is lipoma, it is going away, running away from you. That is a slip sign. So, this is what the question, slip exam. It is SLIP, not SLEEP. Slip exam, short examination. Okay, consistency. Soft lipoma, firm lymph node, hard metastasis. Everything is written on the face of the swelling. Hard thyroid, like lymph malignant. Putaceous consistency. It is something very, what you call, toothpaste-like material. It is sebaceous because the content is sebum and content like toothpaste. And what is the sign? It is a positive indentation on pressure. Is diagnostic of a sebaceous cyst. Oh no, but I cannot exactly say how the swelling is consistent. Sometimes hard, sometimes soft. You are going to diagnosis of a malignancy. Okay, and rubbery, just rubber-like consistency in Hodgkin's lymphoma. So consistency has given you a very good idea. Now comes fluctuation. Fluctuation is what doctor has to do and find out if the content is fluid. Fluctuation is done only if it is a soft swelling, not a bony hard swelling, no point. Soft swelling to find out if the content is fluid. Okay. Mobile swelling are there. What you have to do? You have to fix it first. And then what? Use of index and thumb finger. You have to press it. And what it is? Index finger is active and thumb is passive. Whenever you press the swelling from the index finger, your thumb will be raised. That is how you go for swelling like this. One is the active, one is the passive. And here you have to go for both direction, not a single direction. Because single direction may all muscle also can also fluctuate. So two directions, it is where you will be more important for doing the fluctuation test. And now the swelling is very small. What is the test called as? It is called as Pagets test. How it is done? Because cystic swellings are soft in center and firm at periphery. Hold the swelling and put the finger in the middle of it. If the middle is soft, periphery firm, cystic. Middle is vice versa. Middle is firm, soft at periphery, it is a solid swelling. Okay. Now transillumination. This is a very important diagnostic test. All the fluid containing clear fluid are called transilluminant. Whenever it is thick like blood or pus, they are non-transillumination. Preferably dark. Must use a pen torch and some dark like a rolled X-ray film. Avoid surface torch. Just don't keep the torch on the surface. It will always look transillumination even if it is a hard swelling. So it should be in a one direction, and positive in all clear cystic hygroma, hydrocele, epidermolysis, ranula, meningosis. These are all common diagnoses. Mobility. What is called as an intrinsic mobility. That is mobility on its own. Here you have to hold the swelling gently. Move in both directions. Remember, all tests must be done in two directions, horizontal, vertical. All subcutaneous swelling have got a free mobility. What do you actually mean by free? Whenever the swelling moves more than the size of the swelling, it is a free mobility. Restricted mobility, early feature of malignancy. Bony swelling, immobile. Chondroma, cervical rib, bony metastasis, they are immobile swellings. Okay, diagnosis is coming. Restricted mobility is there because of some adhesions. Sebaceous cyst has got a limited mobility, though it is subcutaneous. Why it is limited mobility? Because it is adherent to the skin at the summit. That blackish spot you call it the punctum. The punctum doesn't allow sebaceous cyst to move freely. On the contrary, it will be indented. So if it's sebaceous, don't say free mobility. Though it is beautifully seen, it is there, it is not a free mobility. Okay. Compressibility. After mobility, compress. Can you be able to compress the swelling? What is it? Whenever you apply the swelling pressure, this will disappear either partially or completely. Okay. And if you remove the finger, again it will reappear. Common in cavernous hemangioma, lymphangioma. And the swelling in the chest, prominent with cough, diagnosis is empyema necessitans. If you press it, it will disappear. Remove your finger, again it will be there. Then comes sign of reducibility, whether the swelling is completely reducible or partially reducible. Reducibility sign is by definition for all hernias. And compression reappears. If you remove the compression, swelling reappears. This is a sign of reducibility. Pulsations. You have to confirm the pulsations. All the pulsations are found in vascular swellings. There are two types of pulsations. One is expansile from the aneurysm and one is transmitted. Transmitted where? Wherever the swelling is in direct contact with artery, though it is not formed by the artery. If it is formed by the artery, it will be called as aneurysm. And here, if you place two fingers over both sides, finger will be elevated and separated. Remember, elevation and separation. These are the two things in expansile. Only elevation, no separation, it is a transmitted pulse. Okay. And one of the things, secondaries from carcinoma of the thyroid occurring over the scalp are pulsatile swellings. So, pulsatile secondary, answer is CA thyroid. Where does it occur? Over the scalp. Okay. So, we have seen what is pulsation. Now comes the plane. So, you have to tell from where the swelling is appearing. Commonest are skin. If you are able to lift the skin, then it is arising from skin. You have to contract the muscle first. Remember, you must know the nature and action of the muscle. After contraction is very prominent, it is superficial. What is it? Lipomas. If swelling arising from the muscle itself, neither it will reduce nor it will move, but its movement will be restricted. And if it is deep to the muscle and deep fascia, it will be comparatively less in size. This according to in relation to the sternometrial contraction. Semimembranous burst of the knee joint will disappear on the flexion of knee and will become prominent on extension of knee. Okay, these are the plane where actual swelling is arising from. Now the pressure effects. Pressure means whether the swelling is giving pressure to the periphery. Sarcoma, venous edema. Large axillary lymph node in CA breast, it will be edema of upper limb. Okay, it is what is called as cancer in cuirass, where it is the most painful lipodermatosclerosis of the upper extremity because of a secondary from CA breast. It is an inoperable and unfortunately very painful condition. Then you must see regional lymph nodes. Now yours it is a part. Never forget this. Local examination is a regional examination. Similarly, if the swelling is near joint, see the function of the joint. Because sometimes the pathology may be arising from the joint and it is progressing or seen on the periphery. Okay. Now we are coming to what is called as a clinical diagnosis, probable diagnosis, provisional diagnosis. So this you must be ready by now. You have examined everything and now you should tell the examiner probable diagnosis. First, try to give first diagnosis which is most common. Most common on what? What region is involved and whether swelling is congenital or whether swelling is acquired or whether swelling is malignant. That will give a first clinical diagnosis. But sometimes there can be funny. So you must be prepared for near similar differential diagnosis. Okay, it is one diagnosis but similar differential diagnosis. Don't go for different type. You're talking of thyroid and suddenly going for pulsatile swelling. No. If it is thyrotoxicosis, you can think of pulsatile swelling. So your differential diagnosis also should have some reason. It is what is called as a matching differential diagnosis. First diagnosis you are giving of cystic swelling and second diagnosis giving of the hard swelling. No point. You must have a second mind as a cystic swelling but arising from different. So that is how you have to come to clinical diagnosis. Now how to substantiate? You have to investigate. All investigations what we describe in detail in ALSA. Blood investigations, pathological investigation, radiological investigation, FNAC and whenever indicated excision biopsy. USG X-ray. The investigation depending on the likely pathology of the swelling. Now comes the treatment. For all the swellings which are not part of a major pathology, the treatment is excision and biopsy. Now one more thing you must know. Histopathology of specimen is a must. Do not throw specimen. Show to relatives and carefully hand over labeled specimen to a patient relative or to our attendant for histopathology. Okay, don't throw it. Show to the relatives. Let them be satisfied the surgery is done and label it correctly. This is essential part and this is the primary management. Rest of the management depends on the pathology. So this is a graph. It is easy to remember. What it is? Analysis of swellings based on consistency. Because we are always looking at consistency. There are three types of consistency. Soft, firm and hard. It is soft. Always think of sebaceous sheet. Then diagnosis, dermoid cyst. Why dermoid? There is a bony depression. Why sebaceous? Indentation and sign of molding. Lipoma. Why lipoma? Slip sign is present and it is fluctuant. And anterior triangle of neck, fluctuant swelling, branchial cyst. They are all soft swelling we are talking. Transilluminant swelling, think of a glandular or lymphangioma. Once test is added, transillumination negative but swelling is compressible, think of hemangioma. And there is a continuous thriller murmur, think of arteriovenous fistula. So these are different types of a soft swelling. And one additional test, diagnosis is done. Our swelling is firm. First diagnosis, if it is firm, mobile and tender, diagnosis is neurofibroma. Looks like tuberculosis, it is a lymph node. Most common diagnosis, particularly in neck and axilla. The lymph nodes can be tuberculous, axilla, lipoma, lymphoma. Third is fibrolipoma, very common diagnosis of a first swelling. Pulsatile swelling, think of carotid body tumor. Soft tissue sarcoma, very common now. It has got a variable consistency. It is not soft nor firm. It is a variable. And in addition, swelling has got a local rise in temperature. Think of a soft tissue sarcoma. Okay. Now third consistency is hard. Hard diagnosis is, commonest diagnosis is malignancy. Restricted mobility occurring in periphery, commonest is secondary in lymph node. The hard swelling in periphery, commonest is secondaries. Another fibromatosis, malignancy itself, hard, irregular, fixed. And hardness, bony hardness is a bony lesion. What are the common bony lesions? Bone tumors, cervical rib, and bone metastasis. Cervical rib also can be easily palpated, hard swelling in just above the clavicle. It is cervical rib. Okay, this is also the diagnosis. So this is how you can analyze the swelling based on the consistency. Now this is in short. If you remember this total page, you are passed. Okay, how it is? Tensely cystic swellings in neck, breast and deeper may feel firm, but careful examination may reveal they yield to fluctuation. So do not go by first judgment. Deeper swellings can be cystic, but here fluctuation will be there. Be careful. Do not try to elicit fluctuation in intra-abdominal cystic swelling. Don't do that. Lipoma does give fluctuation even being solid tumor. Why it gives fluctuation even if it is solid? Because fat at body temperature behaves like fluid. Okay, fat at body temperature behaves like food. That also gives cross fluctuations, or it is a pseudo fluctuation in lipoma. Why it occurs? Fat at body temperature behaves like fluid. There is no fluid, so it is pseudo fluctuation. Do not say sebaceous cyst is fluctuant, because even if it is fluctuant, it is yields and molds. That is why there is no question of the fluctuation sign to be positive. Sebaceous is non-fluctuant because of a shape change. If hard, do not mention fluctuation and transillumination. Remember, you are saying hard swelling and they say transillumination negative. Why did you do that? Because you are not supposed to do transillumination in a hard swelling. Transillumination and fluctuation is for the soft swellings. If you are wrong in eliciting and interpreting fluctuation test, entire sequence will go wrong. So you are going in the wrong direction and you will do Chennai rather than going to Hyderabad. Okay, so be proper in selecting your way and do this carefully. Similarly, if it is related to muscle, it is a must. You must know the insertion and action of all important muscles near the joint, because the examiner may ask them. And what is the principle? Before contraction, you have to move the swelling. Okay, then only you will know how much the muscle contraction offering the resistance to the mobility. So this is a clinical wisdom you must carry. And malignancy should be suspected when the swelling is growing rapidly. Becomes painful. Why? Due to infiltration of nerves. Swelling becomes vascular, red colored with dilated veins, again malignancy. Fungation or fixation, malignancy. Restricted mobility, again malignancy. Lipoma of the neck is most common site for lipoma. Always remember, it tends to grow very rapidly, very rapidly, in large size, and you cannot make out lobulated dimpling cannot be made out. And here the age slip test for a lipoma is diagnostic. In large lipoma, this test may not be positive due to the large size. It is called as a giant lipoma. What it is? 10 centimeter. Even there are lipomas known to have 1 kilogram of weight. Okay, this is how these common things. First, you must know these basics. Now we'll just shortly consider few common things. What is it? Lipoma, cyst, dermoid. These are the common, and sebaceous. These are the commonest way. We'll consider few in short, for a short note also and for a practical exam. What is lipoma? Benign neoplasm arising from yellow fat. Fat in lipoma is considered unavailable for general metabolism. Now remember, fat is a storehouse of calories. Fat gives 9 to 11 kilocalories per gram. it is best. But this fat, even if it is very large, it is out of circulation. This you must remember. Most common benign tumor. It is called universal tumor because it occurs anywhere except brain. You must know, everybody should know, it doesn't occur in the brain. And sebaceous does not occur on plantar surface. They can occur on dorsum but not plantar surface. Lipoma can occur on the forefoot. On the foot, lipomas are common. It can be localized, encapsulated or non-encapsulated. Okay. Diffuse lipoma are non-encapsulated, common in palm, sole, head and neck, and subcutaneous plane. And if it is subcutaneous plane, intramuscular plane, the surgery is difficult. That is why recurrence is high after incomplete removal. Remember, don't take the lipoma surgery like, I have removed like this. Even if one edge is remaining some corner, it will recur. So be careful of the complete removal, because the large size itself, very large incision, everything becomes major. Your incision is through and through, one side of neck to other side of the neck. Superficial lipomas are more common. Most of the lipomas are less than 5 cm. This is for MCQ. Dercum disease is a painful multiple lipomas. This is a Dercum disease. Mainly seen in female, 30:1 ratio. This is also for short note. It is a tender fat deposition on the trunk and girdle, that is back. Malignant transformation of lipoma is non-existent because liposarcoma arises from primitive mesenchymal cells. Common anatomical site: subcutaneous, subfacial, intramuscular, or intramuscular where in anteroabdominal wall. Lipomas can be periosteal, subserosal, submucosal, common in GI tract. Why this GI tract is important? Because these lipomas in children act as a needles, that means starting point for what you call as a, whenever the intestine goes into another intestine. That is a condition where this lipoma is very important, and it is intussusception. Intussusception, most common cause is submucosal lipomas in a small intestine. Okay, what are the clinical features? Localized swelling, lobular surface, not tender. Fluctuation not, it is non-transilluminant. Slip sign is diagnostic of a small lipoma. Skin is always free as against sebaceous cyst. Trunk is most common site. Among them, nape of the neck and limbs, mainly scapula. Back of scapula, front of scapula are most common site. This is general. Differential diagnosis: neurofibroma or cystic swelling. How do you investigate? USG or CT, commonly done. FNAC should be done to diagnose. Complications: it can be myxomatous change, saponification, and what I told you, submucosal lipoma can cause intussusception and intestinal obstruction, and it is a major emergency in children up to 4 to 6 years. So what is the treatment? Excision. Either you do under general or local anesthesia. And one thing, recurrence is 11%. Never take this lipoma lightly. You must remove. 11% is very large amount of recurrence. Even hernia recurrence is 2 to 3% with the mesh. So recurrence of lipoma, which is a very common surgery. Do not forget to remove every part of the lobular structure, because there are different lobes like 1, 2, 3, 4, one going here, one going there. So don't forget, remove everything. Okay. Now come the commonest diagnosis: cyst. Cyst means bladder. It is a collection of fluid in a sac lined either by epithelium or endothelium. By definition, it can be true cyst or false cyst. True cyst is lined by epithelium. False cyst does not have epithelial lining. So false cyst is pseudopericarditis cyst. Clinical features: hemicardial swelling, smooth, non-tender, well localized most of the times. Few of the cysts can be transilluminant, and cyst presentation depends on the anatomical location pathology. Effects: compression, infection, calcification, cachexia. Where does the cachexia occur? In malignant ovarian cyst. Patient has got a severe cachexia. This is the commonest problem. Malignant ovarian cysts are very common. Okay. So, in short, again for your exam answer, swellings which are brilliantly transluminant. You know this is from book. Ranula, cystic hygroma, epididymous cyst. And the name is Chinese lantern pattern. Hydrocele, meningocele. These are the brilliantly transluminant swellings. And what are the different type of cysts? A. Congenital, dermoid or tuberculosis. B. Acquired, retention cyst or Bartholin cyst, parotid cyst, distension cyst. Distension cysts are ovarian and colloid goiter. Colloid goiter is a distension cyst. Exudation cyst, slow exudation of a fluid, bursa, hydrocele and pancreatic pseudocyst. Cystic tumors, dermoid cyst of ovary, commonly cystadenoma. Traumatic cyst, trauma occurs, hematoma, where does common? Thigh, loin and shin. Eventually, there is endothelium lining and there are cholesterol crystals. It is a traumatic cyst. Degeneration due to, in the solid tumors, it is a necrosis of tumor. And parasitic, our best friend is hydatid and cysticercosis. So next is common swelling is a dermoid. We have considered lipoma, cyst and dermoid. Dermoids are common as what? Sequestration dermoid. What is sequestered? Sequestration of epithelium rather, or the collection of it. Most commonly they are congenital. They occur at the line of embryonic fusion. Because why? During development, epithelium is trapped in the surface, then afterwards it is cut from the so it gets sequestrated and it is in the deeper plane. Common sites: forehead, neck, post-auricular dermoid, external angular dermoid, root of nose and sublingual dermoid. In fact, the position itself will diagnose the dermoid. Anywhere in the midline. Occurring in the skull may extend into the cranial cavity. That is why dermoid occurring over the skull, you must do CT scan first and then only operate, because there can be extension. So that extension must be known preoperatively. What are the types? External angular dermoid, internal angular dermoid. These are two commonest sites. What they contain? Cootie-like discriminated material. Hair follicles, sebaceous and sweet. This is the content of dermoid. Sometimes in rare cases there can be even the teeth, jaws. Okay, they are also known in dermoid. It is lined by dermal and epithelial region. Okay, and it can be giving rise to, rather it gives rise to very important bone indentation are very common, but sometimes it may not be there. So what are the features? Painless swelling in line of embryonic fusion. It present in second or third decade onwards. See, so many, they have taken 20-30 years, but they are embryonic fusion. They are congenital swellings, but they occur in the second and third decade. They have given long time for its change, for to destroy it, but it is not so. So it is a small swelling, non-tender fluctuant. And here you are doing which test? Pagger's test is positive. How it is done? Swelling is fixed with 2 fingers and summit is indented to get yielding sensation due to bleed. They are non-transluminating and there is a resorption and indentation of bone. Whenever there is intracranial extension, there is likely to be impulse of cuffing. So you must always test impulse on cuffing in case of a dermoid of the face. Differential diagnosis: commonest sebaceous cyst, lipoma. Investigation: best is CT brain. Treatment: excision under general anesthesia, because if it is extended, neurosurgeon has to be involved. So these are the types from book. Sequestration dermoid: cysts outside skull bone, cyst with bone indentation and with dura attachment. This is where the neurosurgeon comes to play. Cyst connecting inside the with a stalk, and entire cyst is intracranial, which is fortunately very rare. So you have finished lipoma, cystic swelling and dermal. So we are coming to the end of a examination of swelling, and I am sure if you just follow the basic principles and keep your eyes open and also the mind open and try to remember what you have been taught in last 3.5 years, that will make you a best student, and all the best wishes. Next time we will consider the different term. Thank you very much. Good day.